All right. Good day, everyone. So we will have a continuation of Module 9, but this time we will be talking Chapter 4A, which is the principles of care. It's the foundation of quality care. If you will look at your book, the palliative book, it will be Chapter 4A. Okay. So again, Chapter 4A, it's all about principles and practices. So when we talk about the key principles of care, in the palliative care, make sure that we are considering the safe and effective care as all the time. Even if, remember, it's always a standard operating procedure for all healthcare settings, with whatever your client's condition is, whatever type of care we are giving, we always provide safe and effective care. Okay? And always part of the DIPS process, the safety, the dignity, which is respecting the client's dignity no matter what, and of course promoting independence and follow whatever policies that your company possess. So those are very important principles of care. Next, person-centered care. So in the palliative care approach, it's also considered that we always need to have a person-centered care or a client-centered care. We are focused on our clients' needs, our individuals' needs, making sure, remember, in the palliative care, that we are focused on the management of their pain, the quality of care that we give to them in the remaining days that they have, and make sure we respect the references, right? That is included in the client-centered approach. Respecting whatever their preferences is, making, as long as it will not hurt them or it will not be against the policies, then we need to respect that. But if you are not sure if it's right to do so, always consult your supervisor first, the nurse in charge, or whoever in the floor, making sure that you are doing the right thing, right? Also encourage participation. If your client is a little bit tired already or whatnot, whatever they want to do, our main goal is to provide them comfort, right? In the palliative care approach. Although we encourage them to participate, let's say, Mr. Smith, it's your meal time. Do you want to have a little bit of a sip of the soup or something like that, right? It's always good that we still encourage them and maintain the dignity that your client have, right? So even they are palliative care, make sure that we provide privacy, we respect their preferences, and that way we are giving them or maintaining the dignity that they have. What else? What are the safety and care? Making sure we prevent additional injuries, because all we wanted is to give them the comfort and the pain management, and making sure that we use proper equipment if they're using Hoyer lift to transfer from bed to wheelchair or from bed to the commode. We need to make sure that we are following the protocols. It will always be a two-person assist, right? Follow infection control protocol. So if the client is isolated because of a certain cold or whatnot, make sure we need to follow certain protocols, wearing proper PPE, hand washing, hand sanitation, etc. And also report your hazards. If you see that there might be a potential hazard in the work setting or in the client's room, make sure you report it immediately or you do something to avoid the hazard. Okay? It's very important that safety is a priority even in the palliative care. Communication. We need to communicate with our client, with the family members, and even with our coworkers with a clear and respectful manner, right? Active listening, especially if the family member are giving instructions when they are visiting, make sure we listen carefully, and we need to pass that information to the nurse supervisor. Report the information, as what I mentioned, that we need to pass that to our nurse supervisor, and we need to communicate with whoever the individual we're talking to in the workplace in a professional approach, right? Like using the proper or appropriate words uh, as much as possible. Manners is very important when we do the communication process. Okay, what else? Infection control. So again, in infection control in the palliative care, hand hygiene is part of it. Use proper personal protective equipment like gloves, mask if it's needed, gown, what else, face shield, etc. Right? And make sure that if you're using a certain equipment for the client, make sure we need to clean and disinfect them before and after use and prevent the disease spread. So if the client, even if in palliative care, if the client is under isolation, make sure that we need to properly hand wash, use the proper PPEs when especially before and after entering the room, and make sure that we don't spread it to the other clients. Okay, that's very important. Assisting with their ADLs. So bathing, dressing, eating, mobility, or like their mobile or their like transfers, making sure that it's always part of our task. If the client is too heavy, make sure to ask assistance or to ask for help from your coworkers in terms of baiting or transferring them using a Hoyer lift. It's always a two-person assist. Follow everything in the care plan: how you bait them, how you dress them, how you feed them, and how you transfer them. And as much as possible, even if in they're a palliative care client, still promote independence if it's needed, if they can do so. Okay? It's not a force act. You're not forcing them, but promote if it's possible. What are the ethical practices that we need to follow in a palliative care? Of course, it's always important that we need to maintain confidentiality. When we talk about confidentiality, making sure that we maintain the informations, health information, personal information private within the team, within the group of individuals, right? Like our team, like work team, right? We're not allowed to share it to other units, even your friend is working there as a PSW. Ethical standards. I know there's might be a dilemma, but we need to always maintain and respect whatever in the care plan, whatever in the due process, right? We know, let's say for example, we are so religious, we are a person with very active in church. However, our client is not, right? We don't need to inculcate or we don't need to force our religion to the client because they are in a palliative care. No, we need to always respect the ethical standards in a certain company on a certain policy, right? Honesty is always be important. Always report whatever you have seen, whatever is only visible to your supervisor, and always tell whatever the truth to your client. Okay, do not fake your information because honesty will always be the best policy. Respect the rights of your clients, the family members, even whatever it is there. It is the right to choose. It is the right to choose their references or their preferences. If they want to do something or request something, consult your supervisor if it's okay to do so. But again, don't underestimate or don't what do you call this? Do not set aside their preference. Okay, respect them. Always respect. What else? Documentation. In documenting your observations about the client's condition, make sure it is always the facts. It's always giving the accurate information and it's timely. What time did the procedure happen? What time did the symptoms show up? Always make sure you document on a timely manner. Use a correct terminology all the time that is been accepted in your company. Okay? Again, it should be factual and for documentation because that will serve as a legal uh, compliance, right? This will be served as your legal document in case it is needed in the future purposes. Okay? So make sure you write your documentation professionally. Remember, documentation, you should not put I, you should always put or write a PSW assisted client A in bathing. All right. So that's a general documentation, but that's how you should do it. You should not put I. Teamwork is also important in the palliative care approach. Collaboration with the team is essential because if you will be working as a team, it will be easier for the client to be assisted and it will be easier for us to achieve our health goals, right? Share your information to your team or to your coworker that's giving care to your client. Make sure we support our coworkers if they needed help in terms of assistance, right? If there's a teamwork, there is a continuity of care. It's very good when there's continuity of care because we will achieve our common goal or our common purpose for the healthcare to our clients. Professional behavior, making sure that you know your boundaries as a PSW. Don't go beyond your limits. Don't be complaining as well all the time. Making sure you need to be respectful to your coworkers, to the client, to the family members, and etc. And always follow the certain rules, right? Always follow the company policy, whatever it should be, and always open to continuous learning. If there are trainings that your company is offering, if you're qualified to do so, please attend because that will be your additional learning. There might be some challenges in the practices, of course, the pressure of time. So that's why it's very important that you will always do it in a smart way, conduct or do your tasks appropriately and timely. Also, emotional stress, because we all know that client is on a palliative care. There might be tendency that they might gonna be passing away for a certain time or any time, and that will affect our emotions, right? Especially if we are taking care of our client for a long period of time already. So make sure that we need to be very strong enough in terms of our emotions. If you need to seek guidance and counseling, always approach your supervisor. Also, there might be some communication barriers. If your client or the family members cannot speak English, right, that will be a communication barrier, have a great impact in terms of the practices. And also the workload. If you are working from one place to the other without even rest in between, that will give you burnout, right? So make sure that you always manage your time appropriately and accordingly without affecting all your clients and of course without affecting your health. Make sure, guys, just a reminder in terms of giving your palliative care, prioritize the safety of your client. Always follow the care plans, whatever stated in the care plan. Uh, Make sure you always ask your supervisor if you are not sure of what you're going to do, and stay professional at all times. Okay? Stay professional at all times. Okay, so we will have a short essay questions later on. I will not be posting that one now, but that is our discussion for chapter 4A in module 9, and I'll see you again in chapter 4B. Okay? We're still in module 9. See you in a bit.